So, good morning, ma'am. Good morning, classmates. I am Johanna HISU-AN, and today I will be presenting cholinergic antagonist and anticholinergic. Presentation overview. Objective: to compare the responses of cholinergic agonists and anticholinergic drugs. Differentiate between direct-acting and indirect-acting cholinergic agonists. Contrast the major side effects of cholinergic agonists and anticholinergics. So what is cholinergic agonist? Cholinergic agonists are drugs that mimic or potentiate the action of the neurotransmitter acetylcholine. So here is the image of cholinergic agonists and anticholinergics. These are the direct-acting parasympathomimetic or cholinergic drug, and in the right side is the indirect-acting parasympathomimetic cholinesterase drug. Cholinergic drugs, drugs that produce actions similar to stimulation of parasympathetic system, or similar to ACH. The direct produce primarily effect by binding directly to cholinergic receptors, which are muscarinic or nicotinic or both. Classification according to chemical structure: tertiary and quaternary. Tertiary is composed of nicotine and lobeline, while quaternary composed of ACH, methacholine, civimilin, carbachol, and bethanicol. While indirect, act indirectly by inhibiting acetylcholinesterase, thus prevent the hydrolysis of ACH. They are called cholinesterase inhibitors or anticholinesterases. So, indirect is composed of reversible and irreversible. The reversible is composed of indrophinium, neostigmine, physostigmine, pyridostigmine, ambinonium, and donepezil. While in the irreversible, organophosphorus compounds, icosahexaphosphate, and warric gases, and parathion. So in the reversible anticholinesterases, short action, intermediate action, carbamate esters. Drug: neostigmine. Chemical structure: quaternary ammonium compound. Administration: can be used orally, but its absorption is poor because it is ionized polar. Kinetics: 0.5 to 2R. Polar: prominent action on GAT and urinary tract. Clinical uses: myasthenia gravis treatment, nicotinic action, paralytic ileus like bethanicol, which is direct drug, urinary retention, competitive, neuromuscular blockers, intoxication. Next is physostigmine. Chemical structure is tertiary ammonium compound. Administration: good oral absorption, can be used in the eye. Kinetics: 0.5 to 2R, the only nonpolar lipid soluble. Clinical uses: glaucoma, atropine toxicity, anti-muscarinic drug. Because it is a tertiary amine, lipid soluble, it can cross the BBB, thus it is used to treat the CNS effect of atropine and other anticholinergic drug overdoses. Next drug is pyridostigmine and ambinonium. Chemical structure: quaternary. Administration action is none. Kinetics: 3 to 6R and 4 to 8Rs, respectively. Polar. Clinical uses: myasthenia gravis treatment. Next drug is edrophonium, simple alcohol. Chemical structure is quaternary, forms weak hydrogen bond, electrostatic forces. Administration: not absorbed orally. Given by injection because of the high polarity. Kinetics, 5 to 15 minutes, polar. Clinical uses, diagnosis of myasthenia gravis, not for the treatment since it has a very short duration of action. Next drug is the Nepizil. Chemical structure none. Administration given orally. Kinetics none. Clinical uses used for treatment of dementia, loss of memory of Alzheimer's disease, but not the disease itself. So we will go to cholinomimetics, or both direct and indirect. These are the adverse effect and contraindication. Adverse effect, diarrhea, bradycardia, sweating, and salivation. Lastly, the bronchoconstriction. So in the contraindication are bronchial asthma, peptic ulcer, urinary incontinence, angina pectoris, and intestinal obstruction. Diseases that are here in the cholinomimetics. Glaucoma, which is in the eye, drugs for treatment, pilocarpine, carbachol, physostigmine, and ecothiopate. Type of cholinomimetics, direct. In the pilocarpine and carbachol, it is direct, while in the physostigmine and ecothiopate is indirect. In the urinary retention and paralytic ileus, drugs for treatment are bethanicol, which is the type of cholinomimetics, which is direct, and in the neostigmine, the type of cholinomimetics is indirect. In the disease which is myasthenia gravis, the drugs for treatment are pyridostigmine, neostigmine, and benonium. Type of cholinomimetics, only indirect. Xerostomia, dryness of the mouth. Drugs for treatment, pilocarpine, civimilin. Type of cholinomimetics, direct. Dementia of Alzheimer's disease. Drugs for treatment, donepezil. Type of cholinomimetics, indirect. So these are the two major families of cholinergic receptors. First is muscarinic. This receptor family earned its name because it was first identified using muscarine, an alkaloid found in earthine poisonous mushroom. Second is nicotine, a neural nicotine, or NN, located in automatic ganglia. Muscular nicotine, or NM, located in the neuromuscular junction. Location of muscarinic receptors. Ganglia of PNS, autonomic effects organs, heart, smooth muscle, brain, and exocrine glands. Location of nicotinic receptors. CNS, adrenal medulla, neuromuscular junction. So these are the effects of cholinergic agonist. In the body tissue, cardiovascular response decreases heart rate, lowers blood pressure because of vasodilation, and slow conduction of atrioventricular node. Gastrointestinal 1 response increases tone and motility of smooth muscle of stomach and intestine. Third, genitourinary response contracts muscle of the urinary bladder, increases tone of ureters, and relaxes bladder. Fourth, glandular response increases salivation, perspirations, and tears. Lastly, fifth, striated muscle 1 response increases neuromuscular transmission and maintains muscle strength and tone. So what are the clinical indications? Acetylcholine is used to achieve meiosis during ophthalmic surgery. In general, it is rarely used because it has widespread effects and is so rapidly hydrolyzed by acetylcholinesterase. So what are the adverse reactions? Diarrhea and decreased blood pressure, urination, meiosis, bronchoconstriction, excitation of skeletal muscle, lacrimation, salivation and sweating, and dumbbells. So let's proceed to anticholinergics. What is anticholinergic? Anticholinergics are drugs that block the action of acetylcholine. Acetylcholine is a neurotransmitter or a chemical messenger. It transfers signals between certain cells to affect how your body functions. List of anticholinergic drugs: atropine, belladonna, alkaloids, benztropine mesylate, clindinium, cyclopentolate, dorifenacin, dicyclomine, fesosterodine, flavoxate. How anticholinergic work? These nerve impulses are responsible for involuntary muscle movement in the gastrointestinal tract, lungs, urinary tract, and other parts of your body. The nerve impulses help control functions such as salivation, digestion, urination, and mucus secretion. How anticholinergic works. Blocking acetylcholine signals can decrease involuntary muscle movement, digestion, and mucus secretion. Uses. Anticholinergics are used to treat a variety of conditions. These include chronic obstructive pulmonary disease or COPD, overactive bladder and incontinence, gastrointestinal disorders such as diarrhea, and lastly, asthma, dizziness and motion sickness, poisoning caused by toxins such as organophosphates or muscarine, which may be found in some insecticides, and poisonous mushroom. Symptoms of Parkinson's disease such as abnormal involuntary muscle movement. Mechanism of action. Competitively block muscarine receptors. Pharmacokinetics. Natural alkaloids, atropine, HISU-AN, lipid-soluble, good oral absorption, good distribution, cross blood-brain barrier, which have CNS action, and hyoscine has better BBB penetration. Its effect centrally is more prominent. Pharmacodynamic action of atropine. Secretions, CNS, CVS, eye, genitourinary tract, GIT, and respiratory system. So the pharmacodynamic actions in the CNS, atropine at clinical dose, initial stimulation followed by depression or sedative effect. Hyoscine, sedative effect, antiemetic effect, black vomiting center, anti-Parkinsonian effect, black basal ganglia. High doses of atropine cause cortical excitation, restlessness, disorientation, hallucinations, and delirium followed by respiratory depression and coma. While in the CVS, atropine causes initial bradycardia followed by tachycardia due to blockade of M2 receptor on SA node. AV conduction. Atropine does not influence VP. Vasodilation induced by cholinergic agonists. So the AV conduction is plus V dromotropic effect. Toxic dose, cutaneous vasodilation to atropine flash. While in the eye, passive mydriasis due to paralysis of circular muscle. Cycloplegia, loss of near accommodation due to paralysis of ciliary muscle, loss of light reflex, increased IOP or IOP glaucoma, and lacrimation secretion. GIT, dryness of mouth, gastric acid production, treat peptic ulcer, relaxation of smooth muscles, GIT motility, antispasmodic effect, sphincter contraction, and constipation. Genitourinary tract, relaxation of smooth muscles of urinary bladder, sphincter contraction, urinary retention. Urinary retention can occur in old men with prostatic hyperplasia. Secretion, salivary secretion or salivary secretion to dry mouth, sweating to dry skin. In children, modest doses, atropine fever, bronchial secretion to viscosity, lacrimation secretion to sandy eye. So the clinical uses, CNS, Parkinsonism, example, benztropine, vomiting, motion sickness, example, HISU-AN, pre-anesthetic medication, asthma and COPD, peptic ulcer, intestinal spasm as antispasmodics, urinary urgency and urinary incontinence. Clinical uses in the ophthalmic disorders, ophthalmoscopic examination of retina, example, tropicamide, homatropine. GIT, glycopyrrolate and hyoscine, intestinal spasm, and irritable bowel syndrome. Atropine and diphenoxylate, used for treatment of traveler's diarrhea with opioid. GUT, urinary incontinence and urinary surgery caused by minor inflammatory bladder disorders. Example, oxybutynin and darifenacin. Respiratory disorders, bronchial asthma and chronic obstructive pulmonary disease or COPD. Example, ipratropium or inhalation. Cardiovascular effects, sinus bradycardia, cholinergic poisoning, cholinesterase inhibitors, insecticides, mushroom poisoning. Uses of antimuscarinic drugs, atropine, organ, CNS, uses pre-anesthetic medication, and antispasmodic, hyoscine, organ, CNS, uses pre-anesthetic medication, motion sickness, and antispasmodic, benztropine, organ, CNS, Parkinson's, uses for Parkinson's disease, drug, homatropine and tropicamide, organ, eye, uses fundus examination, drug, ipratropium, organ, respiratory system, uses asthma, CCPD, and inhalator. Drug, pirenzepine, organ, stomach, uses for peptic ulcer. Drug, glycopyrrolate, organ, GIT, and the use of it is for antispasmodic in hypermotility. Lastly, oxybutynin, organ, UT, uses urinary urgency and urinary incontinence. So these are my report and these are the references. Thank you.